my only sunshine. You make me happy when skies are gray. Oh, hello there. Hello, nurses, and hello, world. This is Nurse Cecile, and welcome back to my channel. And yes, we've just hit the 10,000 subscribers. Thank you so much, everybody, for your support. I hope you continue supporting this channel by giving this video a like and subscribing to my channel. Also, if you want to get notified just in case I post more Ask videos, then please click the notification bell. Thank you so much, everybody, for your support. If you're new here, welcome to the team. Video is solely for demonstration purposes only, as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden 10th edition. All information presented are public domain materials accessible to the relevant governing organization's websites. Subtle similitude may be noticeable. However, this is not intended to be definitive guide to the NMC Part 2 test of competence or the OSCE examination. This can be helpful materials for overseas nurses or internationally educated nurses to learn and adapt to the UK clinical setting and transition effectively into practice. For today's topic, I'm going to show you how to write an evidence-based practice. And the topic for today, let's see. Use of honey dressing for venous leg ulcers. So before we get into it, let's first know what we're dealing with today, okay? Let's define some terms. What is a venous leg ulcer? A leg ulcer is a long-lasting or a chronic sore that takes more than 2 weeks to heal. It usually develops on the inside of the leg between the knee and the ankle. Symptoms of a leg ulcer: pain, itching and tingling, swelling in the affected leg, sore with red base sometimes covered by yellow tissues, dark red, purple, brown, hardened skin, and cramping. What causes venous leg ulcers? A venous leg ulcer can develop after a minor injury if there's a problem with the circulation of blood in the leg veins. This happens when the pressure inside the veins increases. This constant high pressure can gradually damage the tiny vessels in the skin and make it fragile. As a result, the skin can easily break and form an ulcer after a knock or scratch. Unless there is a treatment to improve the circulation in the legs, the ulcer may not heal. Diagnosis is largely based on the symptoms and examinations of the affected leg. So they might check for any symptoms associated with venous leg ulcers in the form of a medical history and examination. Doppler test is also used again to rule out any peripheral arterial diseases. These are the conditions affecting the arteries. With appropriate treatment, venous leg ulcers often heal within 6 months. Treatment should always be carried out by a healthcare professional. This includes cleaning and dressing the ulcers, compression, treating associated symptoms such as swelling in the legs and ankle, itchy skin, and most importantly, looking after yourself during the treatment. And last but not the least is the treatment of uninfected ulcers. Ulcers sometimes produces large amount of discharges and becomes more painful. Treatment includes prescribed antibiotics. There are short courses and long-term courses. It depends if the ulcers are not healing. Now, this is where we connect our evidence-based practice today regarding the use of the honey dressing for the venous leg ulcers. Okay, so there's a lot of talk regarding honey dressing as being beneficial when you use it for leg ulcer. Is it or is it not? That's why we got the research to prove it. So you're going to be given a long length of research for you to read. So basically, the scenario revolves around something like this. Yeah. So basically, the scenario goes like, you are the nurse looking after this patient who's undergoing treatment of leg ulcers. So that patient of yours is being treated as per current evidence-based protocol. Okay? So your patient is now arguing that the use of medical honey or honey dressing is more beneficial for your patient's treatment with that leg ulcers. So your patient is saying that the honey dressing treatment is more beneficial rather than the treatment that you are providing at the moment. Again, you will be given 3 studies in which you have to summarize the findings of the article summary, and you have to also draw a conclusion. That's why on your last statement, you have to make sure to use the word in conclusion or therefore I conclude, as long as you make your conclusion. Also, you have to make recommendation for practice. So now, nurses, my question is, how are we going to write this evidence-based practice regarding the use of honey dressing on a venous leg ulcers? Let me just show you first the marking criteria that looks like this. So this is the marking criteria from the NMC. You can go ahead to the NMC site. I'm going to put it right here for you to be able to view the marking criteria. So how are you going to memorize all these things? Not to mention this many evidence-based practice and this many professional values, because whatever you do when you're about to go to your OSCE exam, you will have definitely an API, an evidence-based practice, and a professional values, plus 2 pairs of 2 skills. So all in all, 10. So there's no getting away from this. From all of this, they're just gonna give you 1 topic, which we don't know. You will know during your exam. Now, there's a lot, isn't it? So that's why you're here watching my video, because I'm going to make sure to show you how to highlight the keywords. Highlighting the keywords will help you remember the answers when you're about to take your OSCE exam. When you're already there and you've read the scenario that was given to you, or the research that's given to you, that will be given to you on your exam, and you already know the keywords of what to write, then it's easy for you to write your evidence-based practice. Yeah? So let's start highlighting the keywords now. So again, with this scenario and this marking criteria, we're going to break this one down into a more memorable, or we're gonna highlight the keywords for us to make it more memorable for us to write during our exam. All right? Ready? Okay, so let's start with the first one, shall we? So the first one, we can highlight these keywords.
No conclusive evidence indicating that medical-grade honey improves outcomes.
How's that, nurses? It's easy to remember, isn't it? And then you can just work your way. You can just write your way in accordance to the research, in accordance to that research that was given to you during your exam. How about this next one? No reduction in size of ulcer or healing time. Just remember that and you know what to write next, okay? How about this? Let's give it a try, nurses. Increased rate of pain. Just remember that and you can work your way through it, okay? Yeah? Okay, next one. Help eliminate MRSA. MRSA, by the way, nurses, is methicillin-resistant Staphylococcus aureus, okay? Alright. So how about this one? Maybe we could highlight the word cost-effective. Yeah, that would remind you what to write next. Alright then. So how about this last one? Yes, current evidence-based protocol. So again, nurses, those are the keywords that you need to remember when you get to the exam and when you're gonna have your evidence-based practice station and you are giving use of honey dressing for venous leg ulcers. At least now you know what to run, okay? So are you now ready? So with those keywords that we've just learned, let's write. I'm gonna give you 10 minutes to write this station. I need you to pause this video and write your answers. Ready? Okay, time starts now. And you're back. So, have you written your answers? Yeah, I know you're watching this video so you can watch my answers. Again, just a disclaimer, I have done my research and these are just my answers. I'm not saying they are correct. I'm not saying that I'm gonna pass the exam when I take it. I'm not saying that I'm gonna pass the exam with these answers, but I've done my research and you are entitled to your own research, okay? So do yours as well, okay? And so, the reveal of my answer. So before the reveal of my answer, I would like to ask you to please give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more ASCII videos, then hit the notification bell. It would really mean to me if you support my channel, so I'd be more motivated to make more ASCII videos. And also, comment down below what other ASCII videos you want me to do next. Ready? Enjoy!
I will tell the patient that presently there is no conclusive evidence suggesting that medical-grade honey improves outcomes for patients with chronic venous leg ulcers. I will tell the patient that there is no reduction in size of ulcers or healing time with honey compared with standard treatment. I will advise the patient that patient reported an increased rate of pain. I will inform the patient that honey may contain antimicrobial properties and may help eliminate methicillin-resistant Staphylococcus aureus or MRSA infection, especially on chronic leg ulcer patients, although this was a very small study and requires more research on the subject. I will advise patient that there is no evidence that medical-grade honey is cost-effective in treatment of chronic venous leg ulcers. In conclusion, I will recommend to the patient that dressing of wound should be based on current evidence-based trust protocol until further robust research on honey dressing is conducted.
And just like that, I hope you learned something for today. If you like this video, give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post more ASCII videos, then hit the notification bell. Thank you so much, everybody. This has been Nurse Giselle. See you on the next one. Bye!
We have come to our shout out section. I would like to greet a congratulations to the new passers at Marilu 4710. Congratulations for passing the ASCII exam. Likewise to at Maricor 1010. Hello. Congratulations. Also at Samuel Oluwu Official. Congratulations. Oh yeah, at Afrin Shaikh 1828, can I get a congratulations greeting for at Prabjot Kaur. Congratulations and welcome to the register.